Today I want to talk to you about acid-base balance. We'll start with metabolic acidosis. The main components in the acid-base balance are pH, PCO2, PO2, and the bicarb, which is HCO3. The pH, it defines the acidity or alkalinity of the blood. The normal range is 7.35 to 7.45. If the pH is below 7.35, the patient has acidemia and hydrogen ion level is increased in the blood. On the other hand, if the pH is above 7.45, the patient has alkalemia and the hydrogen ion level is decreased in the blood. The PCO2, this is the partial pressure of carbon dioxide dissolved in plasma. The normal range is 34 to 45 millimeter of mercury. The PO2, this is the partial pressure of oxygen dissolved in plasma. The normal range is 80 to 100 millimeter of mercury. And the bicarb, HCO3, the normal range is 22 to 26 milliequivalent per liter. Let me start with uncompensated metabolic acidosis. Metabolic acidosis occurs when there is an elevation of hydrogen ions in plasma and therefore a low pH, making the blood acidemic. In addition, bicarbonate is low and CO2 is within the normal range. In analyzing the blood gas, first look at the pH, next look at the CO2, and finally look at the bicarbonate. In primary metabolic acidosis, the pH is lower than 7.35. The CO2 is within the normal range and the bicarb is low, normally less than 19 milliequivalent per liter. Here is something to remember. pH drops by 0.08 for every 10 millimeter of mercury increase in the PCO2 in acute processes, but only by 0.03 in chronic processes. In metabolic acidosis uncompensated, the pH is decreased, the CO2 is normal, and the bicarb is decreased. In metabolic acidosis compensated, the pH is decreased, the bicarb is decreased, and the CO2 is decreased. Notice everything is in the same direction for metabolic acidosis compensated. What are the signs and symptoms of metabolic acidosis? Well, there may be rapid breathing, confusion, tiredness, shock, fruity smell of the patient's breath, fast heartbeat, headache, weakness, and nausea. What are the causes of metabolic acidosis? It might be associated with prolonged lack of oxygen from shock, heart failure or severe anemia resulting in lactic acidosis, or exercising intensely, again resulting in lactic acidosis. Medications like salicylate, methanol, or ethylene glycol can also result in lactic acidosis. Diabetes can result in DKA. Starvation can result in ketoacidosis. Excess alcohol ingestion can result in ketoacidosis and lactic acidosis. Severe diarrhea, which might result in the loss of gastrointestinal bicarbonate. Excessive loss of renal bicarbonate, which is associated with acetazolamide therapy, or kidney disease, and severe starvation and dehydration, which can result in lactic acidosis and ketoacidosis. Well, thanks for watching. I do hope that this short presentation would have reminded you of the value of understanding metabolic acidosis. Please don't forget to like, share, and subscribe. I wish you well. Good night.